How you doing? Dr. Bob Letta here. To introduce myself, I'm a health and wellness physician. I have a small private practice in Alaska at my fishing lodge here at All Alaska Outdoors. I built a medical office on the property. It's community health and wellness. It's a part of Cenegenics, which is where I did my training in integrative medicine, or what we like to call age management medicine. I did that about 8 years ago, mostly to save myself initially. Was why I did the training. I was 47 when I really started noticing that I was having a harder time with energy, drive, keeping up with my busy, hectic lifestyle. I'd been an ER doctor, trained, residency trained, board certified. And I was starting to see guys my age without specific risk factors coming in with some pretty bad stuff. And I realized that the medical model never taught me anything about really taking care of the human body. We just throw pharmaceutical products at diseases, some of which work really well and save lives, and some not so much and probably cause some harm. I was getting a little disenchanted with that whole goat rope, and I went and decided I wanted to learn everything I could to take care of myself and my family that was more proactive. And I got enlightened by the Cenegenics Foundation and Dr. Lake, the head of the Cenegenics Education Foundation, and it massively changed my life, rapidly transformed me into a much healthier person. And I couldn't just go on with being an ER doctor the rest of my life. I had to offer this to other people. I still do emergency medicine. I'm weaning away from it slowly, but I'm not out of the grips. I would much rather try to help promote people take care of their health and wellness and not need me, the ER doctor. So that being said, today's topic, at the request of one of my very best and one of my first patients, he's been one of my patients for many, many years, is on sleep. And I'm going to cover quite a bit about sleep apnea because it's a concern of his. He had bad sleep apnea and is treated and effectively, and we made some profound changes in his life over the course of the years I've been taking care of him. He has a pretty decent looking before and after profile. I think he's down about 60 pounds and is a exercise junkie and eats very well and has had a great transformation. But I guess we're going to start with what, as an integrative medicine doctor, there's 4 things that I kind of focus on as far as lifestyle. 4 things that I'm trying to figure out when I first meet a patient, how well they're doing in these 4 domains. One is obviously nutrition, and I cover this extensively in my Facebook Wellness Patients posts. I have a large write-up on what I think the literature says we should do from a nutritional standpoint, and I give some guidelines. It's by far the most modifiable risk factor to prevent chronic disease. Number 2 is exercise, which I would have to say is the second most modifiable risk factor to prevent chronic disease. And then another important component of behavior is sleep. And the final one being stress modulation. And so I'm trying to figure out where my patients are at with regards to these things. Well, why is sleep important? Well, first of all, it significantly impacts attention and memory. I read a study, I'm not going to drag it up out of the archives, where they took military personnel and they compared their effectiveness on the battlefield, sleep deprived versus drunk, and the drunks did better, okay? Sleep deprivation is a real impairment to good cognitive function. It's dangerous to be sleep impaired. if you're sleep impaired, if you're not sleeping well, you tend to have daytime sleepiness. That's not a good thing. It affects how well your mood is. But probably the most important thing about poor sleep is that it leads to all of these things that are markers or aspects of chronic disease. So poor sleep is associated with increase in obesity. Poor sleep is associated with insulin resistance and the development of type 2 diabetes. Increased risk of heart disease and disease of the blood vessels. If you're not sleeping well, you don't produce as much of the healthy hormones, growth hormone and testosterone. During our sleep, our body's resetting itself, but also like growth hormone specifically is secreted during stage 4 deep sleep. And low levels of those hormones lead to metabolic diseases like obesity, type 2 diabetes, and heart disease. So it's a vicious cycle. We know that sleep is associated with poor sleep is associated with systemic inflammation. There's studies out there that show that one night of skipping sleep and your inflammatory markers go up. And your immune function is less on point when you are not rested. Okay, so you're more likely to get viral illnesses and probably more likely to have bad outcomes in viral illnesses. Everybody's concerned about immune health right now during this COVID epidemic that we see. All right, so that's the reason why sleep's important. Now, how much sleep is the right amount? Well, there's been a lot of scientific studies about that. And if you look at the bell curve, most people do best between about 7 and 7.5 hours. That's what the studies on mortality from, giant questionnaires suggest. Everybody has their own sweet spot, and I think if a person is smart, they can figure out how much sleep they need by experimentation and seeing how well rested they are. But generally for an adult, those are the guidelines. Now teenagers, they need 11 to 12 hours, they're growing, babies obviously different, but we're talking about adults. So what are some of the barriers to sleep? Well, the first one, and the one that kind of prompted this talk, is obstructive sleep apnea. OSA is an abbreviation for it. I want to make sure everybody understands some of the pathophysiology going on here, so I'm going to spend a little time on it. Now, it affects men greater than women, and the symptoms are basically a lot of what we talked about there: daytime sleepiness, attention and memory deficits, bad mood, obesity, metabolic diseases, and obviously snoring, and actually respiratory arrest during sleep, where you actually stop breathing while you sleep. There is a quick way that I have patients check this. I mean, generally when I'm interviewing a patient, especially if their spouse is there, during the review of systems, there's a section there where they ask about snoring and sleep apnea and such. And if they check the snoring box, I ask the spouse if available, does it seem like they stop breathing at night? If there's a lot of snoring, it's a concern. Some people snore and don't have sleep apnea, but a lot of snoring is of a concern. I use a little quick check, poor man's check, called Sleep Cycle, which is an app that you can download for free that kind of shows the phases of sleep that you're going into and out of during the night. Load it on your cell phone, you place the cell phone by the bedside, and you can get a sleep score. And I check mine pretty frequently. When I'm able to sleep, I do pretty well. But obviously as an ER physician, one of the problems we have is sleep hygiene, which we'll talk about. There are some lab clues to sleep apnea. Elevated inflammatory markers, elevated blood sugar, signs of type 2 diabetes, high fasting insulin levels, high fasting blood sugar, low IGF-1 levels, which represent, roughly speaking, your growth hormone levels, elevated red blood cell count, a thing we call erythrocytosis. When you are chronically oxygenating poorly from things like sleep apnea or chronic obstructive pulmonary disease or other diseases of the lungs, the body, in order to transport more oxygen, will develop more red blood cells. So that can be a sign. So a lot of times when I get done seeing a patient, between symptoms and physical findings and laboratory evaluation, low testosterone, low IGF-1, high red blood cell count, insulin resistance, looking at the person, they're overweight, and a spouse tells me they're snoring a lot, it seems like they stop breathing, I'm pretty suspicious. Somebody like that, I very well may recommend a full-blown I love saying this one, formal check, a full-night polysomnography, okay? And what that does is it gives you a thing called the apnea-hypopnea index, which is a measurement of whether or not, or to what degree you have sleep apnea. So what causes sleep apnea? Well, most people think of weight, and certainly weight can be a predisposing factor. But as with just about everything in medicine, it's a combination of genetics and behavior. And some people probably can get fairly heavy and never develop sleep apnea. And some people can be ideal body weight and have significant sleep apnea. And this is amazing because I had a brand new patient yesterday. I evaluated him. And this 58-year-old gentleman is one of the most healthy patients I have ever evaluated in my career. His lab markers are immaculate, and he is muscular and fit and 13% body fat. And he and his wife were both there during the evaluation, and it came down and the snoring / sleep apnea box was checked. And I said to his wife, "How bad does he snore?" And she said, "Oh, anyways, we started. I said, "You may have sleep apnea." And he said, "Oh no, I do. I've been checked. I wear CPAP." And I was shocked because he is a specimen. Okay, this guy is amazing looking, right? Muscular, fit, thin, abs, the works. 13% body fat. I do his physical exam, and his uvula, that's the hangy-downy thing in the back of your throat, it's way past the 95th percentile. It looks as big as uvulas that I've seen in people who had acute uvulitis, which is an infection, right? So his is anatomical, okay? And he told me his dad had the surgery, got his uvula cut out. Some people can fix sleep apnea by surgical means. So it's not always obesity that causes sleep apnea. But here's the thing. These soft tissues in the back of the throat, as they increase in size, they expand, probably sitting upright, tongue's falling down, opens the airway, you're awake, you have postural tone to all these muscles in your hypopharynx. You don't have a problem breathing. But you lay down and go to sleep, particularly on your back, and your tongue's falling back, and there's fat tissue in the tongue, and there's fat tissue in the back of the throat that's pushing it out, and there's fat tissue in the soft palate and the uvula that's making it bigger. And you finally get to a point where when you fall asleep and you start to go into deep sleep, the airway closes. And in order to open the airway, you have to wake up. So what happens is there's a drop in oxygenation, and eventually it's disruptive enough that you wake up. So you're just not achieving deep sleep, and you don't get that rest that you need, and it leads to all these things that I discussed. Okay? So, anatomy versus being overweight, combination of the two, some genetic predisposition, some environmental. All right. What's so bad about sleep apnea? Okay, I gave you the kind of hormone stuff, but I'm a diagram guy. I like to show people, how how things are actually occurring, okay? So I've got a little diagram I drew here, pretty rudimentary, that hopefully will help you to understand a little bit about what's going on here, okay? Now, this is a fairly simple drawing. I've got the lungs here, what I like to call the air exchanger. I've got the pump, the heart here, the pump, and then the body. And the orange lines represent blood flow, okay? Obviously, the lungs are where oxygenation occurs. The problem with sleep apnea is up here in the upper airway, occluding at night. But not enough oxygen gets down into the alveoli, which is this little air sac here, with these little capillaries or blood vessels around the outside, where gas, oxygen from within the air sac goes into the blood vessel system, and carbon dioxide, the waste product of metabolism, goes into the air sac and is breathed out, okay? So, this is occurring down at the minute level, the alveoli, the little air sac in the lung. Unfortunately, or fortunately, depending on how you look at it, the body is an amazing instrument that knows how to take care of itself. And there's a function that occurs in these blood vessels, in the smaller arterioles that have muscular linings. Because it's inefficient, if you were to get pneumonia in this part of your lung, no oxygen would be getting into that tissue. So if you continue to push blood through that portion of the lung, then the lung that's going back to the right side of the heart to be ultimately delivered to the body, to the left side of the heart, ultimately delivered to the body, is going to be less well oxygenated. So the lungs are smart. If there's an area of the lung that's not getting adequate oxygen, the blood vessels clamp down so no blood flow goes to that, okay? So, problem is with sleep apnea, all the lung bed is getting not enough oxygen. So we develop a thing during sleep apnea called pulmonary hypertension. The blood vessels are squeezing down. So hold that thought. Now let's talk about this blood flow. Okay, so here's your lungs, and let's say this oxygenated blood from around here is traveling from the lungs to the left atrium of the heart. We have a 4-chambered heart. From the left atrium, it goes into the left ventricle, the big, strong, muscular part of the heart, which pumps it to the body where it can be used for energy needs, and oxygen is delivered to the cells of all the organs, okay? From the body, the blood then goes, and I specifically drew from the legs because we're going to talk about that. The blood goes from the body to the right atrium, down into the left ventricle, which is a muscular pump, not quite as big as the left side of the heart, because it doesn't pump through as much tissue, and then from the right ventricle to the lungs and back over here to the alveoli, and the cycle's repeated. All right, so remember that pulmonary hypertension we talked about? The blood vessels are clamping down. That makes this less strong muscular right side of the heart have to work harder all the time. And what we see is a thing called right ventricular failure. The end result, the bad thing that happens from untreated prolonged sleep apnea, is a condition called cor pulmonale. Now, I could probably find some great pictures on the internet. I'd probably have to get use, or I could beg patients over the years to let me take pictures, but I've had a face full of this for a career of 27 years in the ER, so I'm just going to describe it to you. These poor people, when they develop this severe right-sided heart failure, come in with, because the blood, the venous system that drains the right side of the body into the right side of the heart, because these pressures start to build up because this side is failing, what we see is swelling in the tissues. And the tissues that are particularly affected are the legs. And these people will develop a situation where their legs just swell to massive size to the point where they're just weeping fluid. Fluid just comes through the skin. And generally they start to get some skin changes, some chronic skin changes, and you see a condition called cellulitis, which is infection of the skin. And these poor people get infected fluid in their legs and they have to be admitted to the hospital over and over again and keep their legs elevated to drain the fluid, and we put them on diuretics. And it's this vicious cycle because they've lost proper function of the right side of the heart. You know, when you wait that long, it's been too long. So I guess I'm trying to paint this kind of ugly picture of these nasty, red, infected, weeping legs over and over again. The poor people, you look at them, you go, oh, it's that person again. Oh, that poor person. And you know exactly what you're going to do. You're going to walk in, look at their legs, do some labs, start the IVs, get some blood cultures, and admit them to the hospital with their legs up on IV antibiotics again. It's a miserable existence, folks. It's a bad problem to let yourself get to. But we are able to improve this problem through a number of different avenues. Sorry about that. Okay, so back to my diagram. What are the treatments? Well, sometimes sleep apnea can simply be improved by just sleeping on your side. I have one patient who, did the sleep studies. He was diagnosed with sleep apnea. They found through those sleep studies that if he just slept on his side, he was okay. I sleep on my back, so that'd be tough for me. I suppose I could do it, but I don't know how I'd concentrate on it. I just always sleep on my back. So positioning. There are some oral appliances that are pretty easy and inexpensive that are worth trying, but probably the gold standard, the thing that we all know about, are these CPAP machines. William Shatner's got the special cleaning mechanism for it and everything. That CPAP is continuous positive airway pressure. So what happens is this machine, which covers your nose and your mouth, keeps just enough pressure that the soft tissues don't collapse, the airway stays open, and you tend to be able to breathe throughout the night, avoiding that low oxygen level in the lungs and that constellation of symptoms that ultimately leads to right-sided heart failure, cor pulmonale, the terrible, ugly, giant, weeping legs, and a bad place where you're probably not going to live much longer when you get to that point. Surgery would be an option for some people. Those that get there not by advanced or significant weight problems. But what is the important mechanism in most people is to lose weight. Some other things that can affect sleep are stress, stimulants, caffeine, alcohol, drinking right before going to bed, and then poor sleep hygiene. Sleep hygiene is, well, as an ER doctor, I have poor sleep hygiene when I work and pretty good sleep hygiene when I don't. I try to go to bed at about 11 and 11:30 usually, and wake up at 7, because I've pretty much found that 7 to 7.5 hours is pretty good for me. But when I'm an ER physician working nights, I have to sleep at improper times. And consequently, I do have some of those metabolic markers, some of which may be, I now no problems with insulin resistance or systemic inflammation, but I do typically have low IGF levels indicating poor growth hormone. And that's pretty common in shift workers. It's actually the most notable laboratory abnormality associated with shift work that's believed to contribute to the shortened life expectancy of shift workers, suggesting that sleep is pretty important to your health and mortality. Okay, so I'm jumping back down to strategies for simple remedies for better sleep. Okay, completely dark room. Avoid caffeine before bedtime. Brief napping is okay, 30 minutes maybe. Long napping seems to be associated with increased mortality. I just recently reviewed a pretty well done large study that suggested that. Exercise, but try not to exercise right before bed. Too many catecholamines, amped up hormones get going. It makes it hard to fall asleep. I'm bad about that because my schedule's goofy and I oftentimes have to exercise right before bed. It's 8 o'clock and I'm gonna exercise here pretty soon. Some supplements. You know, I take these two. Magnesium, 500 milligrams. It's an inexpensive supplement. It has been shown to help with relaxation and sleep. It prevents fatal arrhythmias. It's a simple no-brainer. I just about put all my patients on magnesium. About 500 milligrams is a reasonable dose. Melatonin has some good findings. I haven't read this study yet in depth, but there's a study here that shows that this COVID-19 melatonin, there's a biologically plausible mechanism that it may be inhibiting viral replication. So, it's got some really good properties besides just helping people sleep. And again, it's one of the less expensive supplements, and I usually offer it to anybody that doesn't give me great sleep stories in the initial H&P when I see them and we see how it works. Some people find they're too groggy if they take it. L-tryptophan, a gram of that is a reasonable dose. You know, that's the amino acid that's really high in turkeys. It's been theorized that the reason we all want to fall asleep after Thanksgiving dinner is all the L-tryptophan in the turkey that we ate. Probably got a lot to do with we overeat also. We shunt a lot of blood from our body into our intestines to digest the food. It's probably multifactorial, but the L-tryptophan, there's certainly evidence that may contribute. GABA, gamma aminobutyric acid, it's a neurotransmitter. That is a neurotransmitter that's associated with relaxation, and that can be supplemented. There's a compound or a patented blend of plant extracts called Relora, which has some scientific evidence that it's effective. And then another amino acid that's actually present in green and black teas called L-theanine. It's not really very common in the diet elsewhere, and it sort of counteracts the caffeine effects. It causes relaxation. So those are some options. But, you know, what's the real picture to getting good sleep? It's complete lifestyle modification. And that's what I specialize in. I try to convince people to change the way they live so that they will have the greatest health span and the greatest lifespan and have the highest quality of life. And at the end, it comes down to the molecular battle that goes inside our bodies. And there's several ways that you can attack this. I already mentioned number one, nutrition. And for me, that's educating my patients about the extensive amount of study that I've done in the nutritional literature and helping them to formulate a diet that's palatable to them, where they control caloric intake, provide adequate amounts of macro and micronutrients to their bodies, and basically enjoy what they eat without being addicted to what they eat. And I'm very good in most of my patient population at convincing them of the strategy, getting them to implement it, and them finding out that they feel better once I teach them how to eat instead of them eating sort of based on their own hedonistic urges and when they're hungry and what they want to eat. It works. Number two, I've got to train people to exercise, and you don't have to be a gym rat. I work out about 30 minutes, 5 to 6 days a week. I'm not in peak condition right now because I'm 9 months after a Achilles tendon rupture. I was sedentary completely for 3 months. I couldn't do, after I got off where I could walk on it again, I got off of crutches. I couldn't do intervals for for 3 months, and I've only been able to do intense cardiovascular exercise for about 3 months now. So I'm kind of training my way back, and I spent a lot of time not lifting weights because it was just hard to do with what I had going on. The supplements can be helpful. I think that there are a number of supplements, depending on your needs analysis and your genetic predispositions, that can help you beyond just sleep. Help with inflammation, antioxidants that help avert DNA damage from oxidative stress. There's plenty of supplements that can be helpful. Supplements that make you more insulin resistant, or insulin sensitive rather. So there's a role for supplementation, but probably one of the most important things I can do for a patient adjunctively to help them beat the vicious cycle of sleep apnea, obesity, and deterioration in their health is hormone optimization. So one of the things that I do when I see patients is I evaluate their hormones: growth hormone, thyroid hormone, and sex hormones. And since most of my patients are middle age or later, they're generally at that stage of life where their hormones, their sex hormones, are on the decline. And there's ample evidence out there, which I share in lecture format with my patients at some point, that show that replacing the male hormone testosterone, I shouldn't call it the male hormone, the hormone testosterone present in higher amounts in males but in significant amounts in females, necessary for healthy function of the cells in both sexes, getting those back to youthful levels helps combat some of the metabolic diseases that we see. And by the same token, replacing estrogen and progesterone in the female after the menopause also helps combat metabolic diseases. And the combination of diet, exercise, proper supplementation, and getting people back to a youthful hormone level, if you combine those 4 cogs in the wheel, the amazing changes that can happen in your machinery that will reverse metabolic disease are incredible. But one thing I want to point out, when I have a patient that comes into me that is metabolically unhealthy and overweight, if I am highly suspicious that they have sleep apnea, I know I am probably not going to win if I don't deal with the sleep apnea. And that's why it's very important, if it's pretty obvious that you have sleep apnea, that you get it diagnosed and you get proper treatment that's effective. Because if you are not resting, you're not going to recover from exercise. The metabolic changes that I might see, the improvements in insulin sensitivity and in growth hormone, are not going to be achieved even with everything I can do and the change in the way you eat and the exercise. It's going to be much more difficult if you don't address the sleep issue, which could be the root of the problem that got you to the place where you came to see me anyways. So just keep in mind, sleep is almost as important as any other aspect of your behavioral health. I hope you enjoyed it. Hope I cleared up conceptually a little bit of sleep apnea and some of these other things and gave you guys some ideas and some food for thought. Feel free to reach out through my Facebook Wellness Patients. All you have to do is search Wellness Patients on Facebook, join the group. I'll approve you. You can message me there. I'll answer any questions that you might have. If you've got any interest in ever coming and seeing me, I got a great fishing lodge you can stay at. Just reach out. I love trying to help people get healthy. Have a nice night. God bless.